My name is Chester Sharps. I'm with Tuckahoe Orthopedics and practice at St. Mary's Hospital in Richmond, Virginia. I'm a pediatric orthopedic surgeon. I take care of children with their orthopedic needs, pretty much 18 and under. I've been in practice in Richmond for 25 years and certainly make this my home. One of the more challenging parts in pediatric orthopedics is that we're dealing with children and organisms that are changing, growing with time. Many times the operations that we do on younger children, as they grow and change, it can undo the operation, it can make things change in ways sometimes that are for the better and sometimes are for the worse. It's always interesting to try to plan out how much growth is remaining and how your operation is going to be affected over time. If I can fix something in a child and make a difference in their life, then I felt that is the greatest thing that I could possibly do.
I'm Dr. Chad Ahrens. I'm one of the pediatric orthopedic surgeons with Tuckahoe Orthopedics. We're primarily here at St. Mary's Hospital, taking care of kids of all ages from birth until 21. So I recently moved here from Atlanta. I actually went to college here in Richmond and have just finished 1 year of a fellowship in Atlanta, specifically in pediatric orthopedics, meaning that I spent 1 year doing nothing but treating children for that year and getting further education in treating children with musculoskeletal problems. I went into pediatric orthopedics because I enjoyed the variety of diagnoses that you see in kids. Taking care of kids all the way from basically their birth to about the age of 21. Specifically, I enjoy sports injuries and scoliosis. Additionally, I like working with children and kind of the challenge that they present, whether it's not being able to communicate with a 3-month-old because they're not talking yet and still trying to figure out what they have going on. But I also enjoy speaking to the parents and explaining things to them and making them feel at ease with what may be going on with their child. I have a background in physical therapy, which kind of led to that interest in sports medicine. I really enjoy taking care of the young athletes and getting them back to playing. As far as my family, I have moved up here with my wife and our young daughter, who just turned 1 recently, and they're both enjoying the area as well.
I'm Dr. Robert Tootin. I'm with Tuckahoe Orthopedics. I do the majority of my work here at St. Mary's Hospital. I'm a pediatric orthopedic surgeon. I've been practicing for 20 years. I like to get people better. It makes me very happy to get people well, and it's a good feeling to see someone who's having a problem get the problem fixed and let them move ahead with a normal life and a normal existence. Most kids don't bring their problems on themselves. They get there through misfortune or not their own fault. So I like kids. You know, when you deal with kids, you're actually working with 2 patients. You've got the mom and dad and I guess 3 patients, mom, dad, and the kid. And so that does make it a little bit of a challenge, and sometimes it takes a little extra time. You've got to talk down to the child sometimes, and you've got to talk up to the family. But I like to do everything. I like to do shoulders and elbows and wrists and knees and backs, and you're able to do that with kids, and it keeps it interesting for me. I have a lot of experience with scoliosis surgery to the point where I've developed instrumentation techniques and multiple innovations which are unique and have made our surgeries more successful, and that allows our patients to return to their activity more quickly, which is good for everyone. What is it about me that some people wouldn't know? I like to go surfing. I go to Costa Rica every year. We go on a big surf trip, and I like to surf in the summer and fall and spring here on the East Coast. I'm a dad, I'm a father. I've got a 9-year-old and a 12-year-old, and I try to put myself in that parent's shoes, and when I'm making my decisions, I try to make decisions as if it were my child or daughter or brother or niece. concerning surgery and treatment options.